And here is your stem. Sorry. I'm really sorry. It's my
Okay,
fingers.
okay, ma'am.
Okay. Right. So if you have read and understood, considering it surgical pathology station, please tell me after reading the stem, what is your provisional diagnosis?
I have some professional diagnosis. It may be a case of tuberculosis or maybe a
Yes.
case of bronchogenic carcinoma or lymphoma.
Lymphoma. All right. Lymphoma first, bronchogenic carcinoma afterwards. All right. Please, considering if it is tuberculosis, what is the pathogenesis behind this condition?
The pathogenesis of the condition depends upon the organism, virulence of the organism and dose, and the immunity and the hypersensitivity of the host. And here there is the droplet infection occurs and the organism engulfed by the macrophage and then development of the granuloma and the caseous necrosis.
Okay, all right, you've just told me the type of granuloma which occurs. All right, what type of inflammation occurs in tuberculosis?
Uh, Type 4 hypersensitivity reaction.
Good, very good. What are the organisms which are involved?
Mainly Mycobacterium tuberculosis.
Okay, right. And histologically, if I ask you to have a look and describe the image that you're looking at, would you be able to?
Yes, ma'am. It's a gel Nelson staining. Here I
Okay.
can see the macrophage, the Langerhans giant cell, epithelial cell, lymphocytes, the granulation zone.
Yes. Okay. If you could, all right, you could tell me how the cells are organized or structured in tuberculosis, because see, they are structured in a way, and there is description. Would you be able to describe it? See here.
No,
This
ma'am.
is the most, like they are organized or structured in zones. Okay, so there is resorption zone, then
Yeah.
granulation zone, and then more mature connective tissue zone. So they, all the cells of this tuberculosis are organized in the zones. Okay, in order to establish your diagnosis, what test would you do which can help you
Okay, ma'am.
confirm that this
Yes,
is tuberculosis?
I'll do the complete blood count. And then we'll sputum test by Jan Nelson stain. I can do the Montauk's test, PCR test, and I can also do the FNC if there is any palpable lymph node, chest X-ray, and CT scan of the chest.
All right, okay. Uh, all right, can you tell me how this Mantoux test is done?
Yes, ma'am. It is done. We use the 5 tuberculin unit of purified protein derivatives in zero point 0.1 ml, injected subcutaneously, and we observe after 72 hours, and we'll see the if there is any induration more than 10, and then the test is positive, and less than 10, the test is negative.
Okay. After how long you told me?
After 72
2
hours.
hours. Yes, 3 days, 72 hours. Very good. Okay. In tuberculosis, we normally have caseous necrosis and granuloma.
Yes, yes, ma'am.
Would you be able to tell me that there are certain other infections which also lead to the formation of granulomas? Would you be able
Yes,
to
ma'am.
tell me
Yes,
few
yes.
examples?
We'll get the granuloma in the sarcoidosis, schistosomiasis, leprosy, Crohn's disease, rheumatoid arthritis.
Yes. So different conditions like infection, inflammation, and then foreign body. All right. Okay.
Yes,
What is joint cells of Langerhans?
yes. It's a multinucleated cell formed by the fusion of macrophages and monocytes and form the granuloma.
Okay. Which test can be done for the rapid detection of Mycobacterium? Yes.
Rapid
Recombinase
detection.
polymerase amplification.
PCR, ma'am.
Yes. But I don't have PCR. I have recombinase polymerase amplification, RPA. All right. Okay. What fine needle aspiration you said you'll do?
Yeah.
You've done that, and the result comes that there is necrotic tissue, histiocytes, and joint cells, and your diagnosis would be.
Tuberculosis, ma'am.
And all right, what is the proteinous substance that can be found systemically in tuberculosis?
It's the amyloid AA.
AA type of amyloid, yes.
Yes.
All right, what other mycobacteriums, organisms, do you know about?
Yes, ma'am. Microbacterium avium complex, Microbacterium bovis,
Yes, and ulcerans
intercellular.
and cancer as well. Intercellular, yes. And
Yeah.
all right, all right, okay. Once you've taken the sputum sample or sputum specimen, how should you label it for
Yes, ma'am. I will
tuberculosis?
label using the category B UN 3373. Ma'am, I also get one more information in the UK recently. They use the test tube label for the sputum, and there is a using the name of the patient, age of the patient, like this.
Hmm? Yes. Okay, can you please tell me uh, why tuberculosis is a public health concern?
Yes, ma'am. I'll notifying the consultant of communicable disease control about the work in the food factory. Uh, then I will use the advise the use of masks for sneezing or coughing and the anti-TB drug for the patient who are infected.
And isolation. If
Yes, isolation, ma'am.
okay, and how should contacts tracing can be done?
Yes, ma'am. It can be done by identification and diagnosis of the patient who are come in contact with the infected patient.
And what advice would you give to the people or to the contacts?
Yes, ma'am.
Excuse me.
I'll first do the counseling, then screening and the treatment of the patient.
And the family members as well.
Yes, ma'am.
All right, please help me read this X-ray.
It's the X-ray of chest showing the trachea is centrally placed.
Yes,
That there is
and
no bony fracture, bilateral pulmonary infiltrate, and the hilar infiltration, and there is a cavitation or consolidation like in the left
infiltration.
upper jaw.
Yes, yes. Okay, and you see the infiltrations. Right. Good. Thank you.
Thank you, ma'am.